Please get seated. Limo, I did not know you are a politician. Your posture does not present like that. But all in all, WR, UNICEF, IOM, county government, members of the fourth estate, Ministry of Health, a very good morning. Good morning. Happy New Year. Happy New Year. This is the very one meeting that we have started with this year. And this is just an indication that we are very keen on our prevention, promotion, and protection agenda as a ministry, as a country, and equally jointly with our partners. So I want to welcome you all this morning, and I'm pleased to also be here for this very, very important media breakfast meeting where we come together to discuss a public health concern that has drawn attention across the globe and right here in our beautiful country, and to discuss the response to this Mpox outbreak, which has been ongoing since the outbreak was first declared in July 2024. As a country, we are equally very committed to ensuring that we respond effectively to mitigate any potential public health risk to our citizens that may be occasioned by any outbreak, not just by Mpox, but any outbreak. Regarding the current situation in Kenya, ladies and gentlemen, it is important to note that Mpox remains a very, very big threat, not just in Kenya, but the East African region, and in our country at large. We have seen in the past 1 week, we have confirmed 5 new cases. This brings the total number of Mpox cases in the country to 36 from across 12 counties. The highest number of cases by counties is Nakuru County. Nakuru County has reported 10 cases. Mombasa County, 8 cases. Busia County, 3 cases. And other counties reporting are Nairobi, Kajiado, Bungoma, Taita Taveta, Kericho, Kilifi, with 2 new cases each, as well as 1 case each from Makueni, Kiambu, and Uasin Gishu. You need to note that Nakuru seems to be a very unique county, and it's like the apex, the meeting point of very many other people coming from different counties. If you have an entry from Malaba, you have to pass through Nakuru. If you have an entry from right from Uasin Gishu, that road, the meeting point is Nakuru. You're coming from Mombasa all the way through Nairobi, you pass through Nakuru. And hence, you can see the number of cases are quite high. Equally, Mombasa is like the destination point. Anybody coming from Nairobi, going all the way to Mombasa, and probably also coming from Tanzania. The Ministry of Health has put in place a robust surveillance system to quickly identify any potential cases. And this includes close monitoring of travelers, especially those coming from counties where there is an active outbreak, and the provision of timely information of healthcare providers and the general public across the country. The Ministry of Health again has taken proactive steps in coordination with key stakeholders, among them who are in the room, that is the World Health Organization, UNICEF, and other partners who have come in handy. We have IOM, we have CDCs, and all the other partners to ensure that we have the necessary capacity to respond. This includes strengthening our healthcare system, providing our health care workers with the necessary training and personnel protective equipment, and ensuring that diagnostic tools are readily available in our laboratories. I know we have heightened and enhanced the capacity in our laboratories, and unlike before, and especially during COVID, when we could send samples all the way to even South Africa, this time round with Mpox, we have been able to test each of the samples in our laboratories. And those must be lumpy. And you're doing a very good job. They are really, really doing a good job. We have also initiated public awareness campaigns through community engagement with key populations, social and mass media, and dissemination of information, education, and communication materials to educate the general public on how to protect themselves from the disease, and key preventive measures, including proper hand hygiene, as well as enhancing hygiene in hospitality industry, among areas or among others that are vital in controlling the spread of Mpox. I know the last quarter of last year, we were very busy across the country. We met hoteliers, we met truck drivers, their association, we met main key stakeholders who are likely to be giving services, and maybe will come into contact with individuals, and there is the high risk of infection. The role of the media, and that is why we are having this meeting this morning, very critical. As we work on these preventive measures, I would like to take a moment to acknowledge the critical role that the media plays in public health communication. You are very, very instrumental, and especially in the public, that the public receives timely, accurate, and reliable information. There are very many myths that you find out here, and it is the role of the media to accurately report on information, and there should be one source of that information. It should come from the Ministry of Health or stakeholders who are who have authority to speak in regards to matters health, so that as we talk to the public, we can array the fears that they have, and we can also give information on what they need to do to prevent themselves from further infection. So your efforts in educating the public, countering misinformation, and amplifying key messages are invaluable. You know, a simple message like, please wash your hands. It may not even be connected to Mpox as a disease, but you know, the action in itself will help us prevent further infection from the public. So it is through your partnership that we will be able to effectively communicate prevention messages and encourage individuals to seek health care if they suspect they have been exposed to the virus. I want to urge you, members of the Fourth Estate, that we continue working very closely with us and share accurate and responsible information. I have always said we cannot put anything political in matters health. And as we try to roll out universal health coverage, I would want to ask the media that if you have anything political, please do not report on matters health. Let us work together. If there is a problem in this country, it will affect your mother, it will affect my mother, it will affect the people you love most, it will affect people you work with. Therefore, we must work together to make sure that the members of public get the right information. We are looking ahead as a ministry, and we are not going to stop on issues awareness. The ministry is also actively preparing for all scenarios, including the possible emergence of more cases. We are in regular communication with global health bodies and our regional counterparts to stay updated and on development and best practices. Because diseases have no boundaries. We cannot stop any. We can only prevent ourselves and make sure that we enhance our surveillance and equally the screening, and especially at the border points. Now that the schools are open, the Ministry of Education again is working very closely with the Ministry of Health to make sure appropriate measures are also put in place to strengthen and including the infection prevention and control measures and on water and sanitation hygiene. As a ministry, last year we rolled out a program that will see us enhancing issues to do with personal hygiene, basic hand washing, use of a handkerchief, should you be sneezing, environmental hygiene, issues to do with vector-borne diseases that are preventable, malaria, sleeping under a net, environmental hygiene, draining of water, stagnant water, issues to do with the diarrhea, preventable diseases that can be prevented through environmental hygiene, water and sanitation. In this country, we still have about 15 counties that practice open defecation, and eradication of the same is our number one priority. Just ensuring that every household has at least a toilet or a latrine, so that we avoid people going into the bushes, defecating, and when the rains come, it will affect each one of us, whether you have the latrine or you don't. Therefore, to further strengthen the ongoing prevention measures, the ministry is set to roll out the Mpox vaccination, targeting high-risk groups such as contacts of confirmed cases and population that are most at risk of contracting the disease. The media plays a critical role in the key intervention, and we therefore request that you provide accurate factual information to also curb Mpox vaccination infodemics. And that is why the ministry equally has introduced the Social Health Authority, because our population will require to go to a facility where you can be treated at any given time. And what is going to cover you? You need an insurance cover. And the Social Health Authority comes into play at this particular time. Because if issues of prevention, we've gone past that mark and you're unwell, therefore you will require to register. Ask the masses to register to the Social Health Authority. Ladies and gentlemen, I would want to state that it is very, very important to note that NHIF would only cover 20% of our population, whereas the Social Health Authority seems to cover 100% of the population of Kenya. And we are riding on the Article 43 of our Constitution that states that every Kenyan deserves quality education, quality health. Therefore, riding on that, every child, any grown-up, will require to register to the Social Health Authority. Before I conclude, ladies and gentlemen, allow me to make a few remarks around the Marburg virus outbreak, which was confirmed in our neighboring country of Tanzania in an area called Kagera. And the outbreak was confirmed on 20th January 2025. Although we had received an alert on the possibility of an outbreak several days earlier, and on the basis of that, we already have heightened our level of alertness as a country. And Kenya is classified as being a high risk of Marburg virus disease outbreak, primarily due to the fact that Kagera region is a transit hub in the region, with significant movement of the population to Rwanda, Uganda, Burundi, and Democratic Republic of Congo, and Kenya. Therefore, as I mentioned, I would like to assure you that the ministry is on high alert, and surveillance has been enhanced at all points of entry into Kenya. In addition, the Ministry of Health, on the 21st of January this year, we issued a press release on the issue of to the public, which you all received probably, as well as an advisory to the counties informing them of the Marburg virus disease outbreak. A readiness assessment in the progress at the national level and in high-risk counties in collaboration with the Council of Governors. Additionally, we are working with all the other MDAs. We have already sent information, our partners, stakeholders, towards developing a robust national emergency preparedness and response plan. And this touches a whole of government approach, a whole of society approach. So each one of you will be expected to have an input in the response plan preparedness to ensure we do not leave gaps as we move forward. And this will ensure that as a country we are adequately prepared to respond to any outbreak in the event such a situation arises. Ladies and gentlemen, I want to emphasize that while the threat of Mpox is real, the commitment is to. We are also committed to ensure that we give the very best for the citizens of this country. The government of Kenya is committed to safeguarding the health of all Kenyans and in ensuring we are well prepared to disease outbreaks and other health emergencies. In this regard, we have made great strides to the response of this outbreak and preparedness for the possible Marburg virus outbreak, and with continued vigilance, effective implementation of the recommended public health interventions and the collaboration of all sectors, including you, the media, I am very confident that we will win against these public health challenges. I want to congratulate the healthcare workforce who have always been at the front line whenever there are these such outbreaks. And I want to call upon all public health officers to take on the gloves and wear their best suited gears so that we can go out there and ensure that surveillance is done. Our surveillance teams, both at the county level and the national government, this is the time to show your prowess. I know you're doing a great job, but I will keep insisting that we can still do better. To the lab people, thank you, thank you, thank you. Give us the most accurate results so that we are able to treat people as they come. Thank you very much, and may God bless you all. I am looking forward to our continued partnership. WR, you very well know, SDG 17 talks about partnerships. We can't do this alone. We have to come together every now and then. There are those areas that you have a strength, and there are those areas that the government will truly come out strongly. And as the government of Kenya, we are on that lane of saying prevention is better than cure. So let's get prepared. Asante sana.
Kindly allow me to write down the protocol that has already been established, but also want to acknowledge the presence of sister UN agency representatives and delegations from government of Kenya and public and private sector. Hamjambo. My name is Faisal, Sharif Faisal. I'm the Head of Programs and Deputy Country Director of IOM Kenya, and it is my honor to speak to you today. PS very eloquently outlined the extent of the disease that we as a country in Kenya, but also in the region, are addressing and fighting. PSU mentioned that it has to be a whole of government and whole of society. I also want to add that it has to be a whole of region approach, because you mentioned that the disease doesn't know any geographic boundary. So when in July 2024, the Mpox outbreak was announced, IOM, with support from the government of Republic of Korea, was able to redirect some of our existing funding to respond to the Mpox outbreak. And in collaboration with our sister agencies, World Health Organization and UNICEF, and of course, with the Ministry of Health and under the leadership of PS and her team, we have been able to support 11 points of entry to capacitate the officials and strengthen the equipment and infrastructure, including Jomo Kenyatta International Airport in Nairobi, Mombasa, land crossings in Busia, and so on. We have trained over 900 officials, both health and non-health related technical officials, in strengthening their capacity. PS, as you're mentioning, some of the basic hygiene practices of washing hands and some of the messaging that we're seeing around the room today, these are extremely critical to fight this outbreak. So in response to that, we have also been able to produce over 10,000 IEC materials to disseminate these public health warnings and awareness raising messages to the populations of Kenya. So we are extremely proud of our collaboration, and I'm also very happy to announce that we just received some additional funding from the United States government to channel towards responding to COVID and, Mpox and Marburg. So again, PS, under your leadership and with the support of your team and our sister agencies, WHO and UNICEF, will be working together. And as a country, as a global nation, we fought something as difficult as COVID-19 together. So I'm confident to say that we'll be able to succeed against challenges like Mpox, Marburg, and any additional public outbreaks to come. With that, kindly allow me to stop here. Thank you so much.
On behalf of the Africa CDC, I extend my sincere appreciation to the government of Kenya, the Ministry of Health, and the esteemed leadership present here, Madam PS, DGG, Dr. Sultanet, the IM, Director of Public Health, Dr. Grace, esteemed pillar leaders, the ground trop epidemiologists, risk communication and community engagement experts, all in present. We appreciate the efforts that are being done by all the partners to respond to this critical outbreak, that's Mpox, complemented with other threats, the Marburg, and at Africa CDC, the collective leadership and unwavering advocacy and tireless efforts in combating the Mpox outbreak are truly commendable. Your commitment to ensure the safety and security and well-being of Kenyans and the entire African continent is commendable and inspiring. Africa CDC stands in solidarity with Kenya and reaffirms the unwavering support in this critical endeavor. We believe that through continued collaboration, effective communication, and multi-sectoral approach, we effectively control this outbreak and safeguard the health and well-being of the communities. And we are keen that we will support all the pillars, including the emerging immunization of this Mpox disease, and we will continue supporting the government. Thank you.
A pleasure being here, and I'm also extending wishes of a Happy New Year on behalf of UNICEF. Speaking now to Madam PS has just left us, and so has the WR, but I think under their leadership, and thanking to all the officials from the Ministry of Health, from other ministries, to the media here and other UN agencies. It's a pleasure being here. Let me start by extending on our behalf the congratulations to the government and to the people of Kenya, including each and every of you in this room, for having managed to date to keep a very serious threat relatively under control as we stand as of today. The caseload in the region is very high of Mpox, and Kenya to date, as you just heard, is at 36 cases. So I think my first point is, as diseases are global and the region is under a serious caseload, well done so far. We need to continue as a country to keep high alert on Mpox, as well as on other risks that will keep coming. We are more and more exposed to acute events, which can be outbreaks or other emergencies, and I think the role of all of us is going to be crucial. And therefore, which is what brings us here today, the role of the media is essential. So I wish to thank each and every of the media who are here and those who are not present perhaps today for their efforts in joining hands everywhere through the country with different and through different means to reach out to the population with timely, accurate, and simple, understandable, digestible information about diseases and outbreaks. And before that, also about health. As UNICEF, we are here joining hands with many partners under the leadership of the Ministry of Health for a very simple reason. Disease do not spare children. And as a United Nations Children Fund, we are here to help promoting and protecting the rights of children. And these outbreaks, as any other outbreaks, of course, especially in a country like this, where a vast majority of the population is about children and adolescents, needs a clear focus and attention on them and on their needs. To date, since the onset of this outbreak, or Mpox outbreak, we have joined hands with the government, with WHO and other partners, essentially to facilitate and support actions along three streams: the health response to the pandemic, but also the risk communication and community engagement, which is at the core of the day today for all of us, and actions related to water, hygiene, and sanitation. So along these three pillars, we have managed to mobilize resources and support the counties that have been identified by the Ministry of Health as the high-risk counties. I will not go into the details. I just want to say we stand here, we continue standing here. I would like to thank today the MasterCard Foundation for helping UNICEF to leverage resources to date to support the government of Kenya in its response. We will continue mobilizing efforts and resources as required as this outbreak continues, but also in anticipation of other health risks and hazards that may come to the country. A final word on the role of media. You have seen it on slide, you have heard it from the previous speakers. Your role is critical every moment, every day, first of all, in keeping the guard high. People may think that with 36 cases the risk is minimal, and it's not. So the first point is keep people informed about what is happening. You get all access to information from the ministry. Please do help share the correct information, and as you heard, tackle the loads of misinformation that circulate in many formal and informal ways. My last ask, and then I will close it, is as you work as media, please do not forget that children and adolescents are not only a target for your communication. They are possibly the most powerful weapon you have to promote communication. They absorb, they learn, they understand, and they spread through their own behavior messages in their community. So engage them as you work as media into promoting communication about health and outbreaks in the country. I would stop it here, and thanks again to all, and again wishes of a happy 25. Thank you.
So Mpox is a viral disease. It's caused by the monkeypox virus, and this virus belongs to the same family as the variola virus, which causes smallpox. It's a zoonosis. A zoonosis is a disease which affects both animals and humans. So the animals which are affected are usually the small mammals, like the monkeys and the squirrels, and it also affects humans. So the transmission can be from animals to humans, and it can also be from human to human. So this is just a graphic showing some of the mammals which are affected. On the left of the graphic, we can see the animals there. So people come into contact with them when they are handling them. The people who go to hunt for bushmeat, and also during the preparation of the bushmeat. And the contact can also be bites or scratches from the animals. Then on the other side, which is more relevant to us in Kenya, is the human-to-human transmission. And this occurs through direct close contact with somebody who has Mpox. It can also occur through respiratory droplets when you talk face-to-face with a person who is infected for a long time. It can occur through needle injuries, as may happen when people are getting piercings or in health facility settings. It can be vertical from a pregnant woman to an unborn child, and it can also be sexually transmitted. This is very relevant to us in Kenya. This is one of the main ways that it's getting transmitted in Kenya. So next slide. I'm very proud of this slide. These are the symptoms of Mpox, and this analysis was done for our first 23 cases in Kenya. So these are actually the symptoms that were reported by patient 1 to 23 with Mpox in Kenya. So we can see that most of our patients reported that they had rash. Actually 100% came with a rash, then fever, sore throat, genital lesions, body weakness, just feeling generally tired, joint pains, and oral lesions or lesions in the mouth, and so on. So this is actually our Kenyan data of what our patients with Mpox complained of. So why should we be concerned? So many people have been wondering and asking, should we really be concerned about Mpox? Why are we making such a big deal out of it when we just have 36 cases? Is it a big deal? Should we be bothered, or should we just stop and forget about it? The answer to that is that we should all be very, very concerned about Mpox because one, while most of the patients recover from the disease, there are some populations who are very vulnerable. These are the young children, pregnant people, and people who are immunocompromised. Immunocompromised people are, for example, people who have HIV, which is not well controlled. So these vulnerable populations may get severe disease, and Mpox actually can cause death. And many people have died because of Mpox and its complications, so we should be very concerned about it. We have even one person who died in Kenya from one of those vulnerable populations. Then apart from that, it can also cause complications. You can see like the patient who is illustrated there, her skin is extensively involved by the disease. You can see the lesions are all over. These lesions can get infected. Sometimes they happen in the mouth, so the person has difficulties with feeding and drinking. The lesions can get infected and the infection can spread through the blood, what we call sepsis. And sometimes even the eyes can get infected and people can get loss of vision. So while most cases of Mpox are fairly mild and the people recover, it can be quite serious and we should be very concerned about it. Then in addition to that, there are also the psychological and the social and the economic complications. You can see a patient like this with lesions, she can't even go in public. She'll be very stigmatized. She cannot attend her work, or if she's a student, she cannot go to school. And if the patients become very many, then the health system can get overwhelmed. So we should be concerned. Next slide. So there are different types of Mpox virus. We have what is called clade 1 and clade 2. In Kenya, it is clade 1b, which is circulating, and it appears to cause a more severe disease than the clade 2. In addition to that, it's associated with a higher rate of human-to-human transmission, like what we are seeing in Kenya. It spreads easily between people. It affects all sexes and all age groups. If we remember in 2022, we had an outbreak, a global outbreak, which was primarily involving the men who have sex with men, and that one was caused by clade 2. That outbreak remained primarily in one population. Ours is affecting all ages and all sexes, and there's a lot of heterosexual transmission. That means between men and women. So we should be very concerned in our setting. Next slide. The map. No, go back. Yes, that one. So here I just want to highlight to you about Mpox clade 1b. Everywhere where you can see blue, in the Central Africa, in the Democratic Republic of Congo, that is where the outbreak, that is where clade 1b was first detected, and it was actually detected for the first time in 2023. Since that time, it has caused a massive outbreak in the Democratic Republic of Congo, and it has spread to other countries in the region, including Kenya. This is clade 1b, Rwanda, Burundi, and Uganda. These countries like Kenya, Rwanda, and Burundi have never had Mpox in the past. This is the first time we are encountering Mpox, and it's because of this clade 1b. So we can see that it has a high outbreak potential, and it has left where it started in the DRC and spread to other countries. If you look at the other continents like the North America and Europe and Asia, that is India, I'm sure you can see where India is, you can see that the 1b has also spread to other continents. It is yet to cause an outbreak outside of Africa. These are mostly imported cases where somebody travels from Africa, travels to Africa, gets infected, and goes to either Europe or America or Asia. But you can see 1b, it has really spread, and it has spread in a short time, 2023 to 2025. So that's another reason why we should be very concerned. Next. So let's come closer home. This has been very well outlined by the speakers who came before me, especially our principal secretary, but let us just go through it for emphasis. So in Kenya, we declared our outbreak on 31st of July 2024. Our patient number 1 was a truck driver and he was detected at the border between Kenya and Tanzania at our border crossing at Holili, Taita Taveta County. So subsequently, and until now, we have 36 confirmed cases, and the cases are spread in 12 counties. So the map that we have there is just showing us the counties where we have cases of Mpox, and you can see a very clear pattern where the cases are distributed along the transport corridor that goes from Western Kenya until the coast. We can also see involvement of counties along the border with Tanzania. That comes out very clearly in the map. So our outbreak is still very active. Our most recent cases were reported on 20th of this month. So just within this week, we reported 3 more cases in Kilifi and Busia counties. So very much an active outbreak. 32 of the patients have recovered. This is a very good thing, but 2 are still admitted in hospital. 1 is on home-based care, and unfortunately we lost 1 patient in Bungoma County who was one of the vulnerable populations who we have mentioned. In Kenya, females are more affected than males. We have involvement of about 61% females. So this again is work done by our team for our initial cases of Mpox, and all I want to show you there is that it's distributed across all age groups. So from age 0 until age 60, we have cases, but the most affected age group is from around 30 years to around 44 years. So that is clearly illustrated in the chart, which is showing right now. Next slide. Okay, so something else very relevant to us is the occupations which are involved. We can see truck drivers are the highest number, although this was a bit earlier in the outbreak, but we can see that at that time the truck drivers were the most involved population, followed by business people and female sex workers. It's also important to note that we have children, we have some students, these are secondary school students, and other professions. So these are the occupations, just to give us an idea. And it's a very good thing that we have our truck drivers represented in this meeting. We really need you in our response. Next slide. So what have we been doing? We've been having a very active response. It is led by the Ministry of Health, and we are very well supported by our partners in the response and our stakeholders. So a very big thank you to all our partners and all our stakeholders for your support. Thank you so much. So in terms of coordination, we have a coordination structure in place. I'll show you how it looks. We hold regular coordination meetings, and we have an Mpox emergency response plan, which is illustrated there. Next slide. Okay, so what this is showing is our response structure. This is what is called an incident management system, and it is led by a task force chaired by our principal secretary, who was here with us. That is our highest decision-making body. They offer us strategic leadership, and they also assist us with resource mobilization. So below that, at the operational level, we have what is called an incident management system, and this is led by our incident manager, who is our Deputy Director General for Health, who is here with us. He's here. Then we have 4 sections. Operations, that's the main section. These are the people who deliver the interventions. We have risk communication and community engagement. This is the group that has brought us here today. We have our health worker capacity building. We have infection prevention and control, case management, the ones who guide us on taking care of the patients. We have mental health and vaccination. Then these other sections, plans, logistics, and finance administration, our job is to support the operations team so that they are able to deliver the interventions very well. Next. So we've talked about the risk communication and community engagement. They've done a fantastic job. We can see the materials they've created all around the room, and even the one projected there has been created by this team. And they've been doing great dissemination, press releases. Each time we have a new case, this team ensures that a press release is given so that the public can know about the cases. They also do a lot of social media. They did some TV and radio dissemination last year. They do direct community engagement, advocacy meetings like the one we are in now, and of course, as we've said, information, education, and communication materials. Next. Very important, enhanced surveillance at our points of entry. Our teams at Port Health have been able to screen over 3 million travelers for Mpox, just to make sure that we don't get cases coming into the country from outside. They also do contact tracing. This means that whenever we have a case of Mpox, they go and find out who are the people who came into close contact with that person, and they follow up those contacts just to make sure that they are okay and they don't develop Mpox. So we've been able to list 244 contacts, 216 completed the 21-day period of follow-up uneventfully, 19 are continuing, and 9 developed Mpox while they were on follow-up. So we also have what are called rapid response teams. These exist at the national and the county level, and their job is to be deployed to an area which is identified as a hotspot for Mpox. The most recent teams that we deployed from the national level, they went to Nakuru, which towards the end of last year was having very many cases. So there's a team that went there. They actually went in December over Christmas, and they just supported the county teams in controlling the outbreak there. And another team went to Mombasa. Okay, the laboratory, this team, we can't thank them enough. They have a sample management system in place. Our testing is happening at the National Public Health Lab. So there's a very good referral system so that the samples can come and be tested. And there's also a quality assurance system where they share the samples with other labs just to make sure that there's concurrence in the results. So they've tested 386 samples which have come to us from 38 counties. 36 have been positive, 348 were negative, and 2 are pending. They are still in the process of testing. We are also doing health worker capacity building. We've done quite a number of trainings. The image there is a training that we held with the county health teams from the coastal region, just to educate them on Mpox. And now these county teams are educating at the sub-county and the health facility level. We also have guidelines for Mpox. So as I come near the end, the Ministry of Health and all our response stakeholders are very committed to controlling the outbreak. We are very committed, but we all have a role. The media, the public, everybody who resides in Kenya, we have a role. And what can we do? We need to observe strict hand hygiene. This is hand washing and use of hand sanitizers. We need to avoid sharing personal items such as clothing and beddings and towels. Each person should use their own. If we detect symptoms in ourselves or in somebody close to us, we need to report to the nearest health facility so that we can be evaluated. Not every rash that appears is Mpox. So one needs to go to a health facility so that you're tested, you get a diagnosis, and receive the right care. Then very important, we need people to be responsible in their sexual conduct. either abstain or be faithful to our partner who is also faithful to you. Avoid multiple sex partners. This is a risk factor for Mpox. So acknowledgements, I need to acknowledge the Ministry of Health, both at the leadership level and my colleagues. Thank you so much for everything that you have done for this response. I also acknowledge UNICEF, who are our main supporters for this event. They've been with the risk communication and community engagement team from the very beginning, doing a fantastic job. They also support us in the case management, and they also support us in water, sanitation, and hygiene. So thank you very much, UNICEF, highly appreciated. And then our leaders in health, the World Health Organization, we cannot thank you enough. You do so much, not just for the Mpox response, but generally for the health system in Kenya. So a very big thank you to the World Health Organization team. And all our partners, our stakeholders, the representatives of truck drivers, religious leaders, all Kenyans, the media, we rely on you so much to pass the right information to the public. We are truly, truly grateful. So with that, I come to the end of my presentation, and thank you very much.
So when Dr. Michelle was presenting, she said that we have an Mpox outbreak response plan. So in that plan, we have a strategy for vaccination. So Mpox is one of vaccine preventable diseases. Okay? So as a country, we've developed a deployment plan for the Mpox, which has been extensively informed by what Dr. Michelle presented in the morning, our epidemiological data. Okay? You remember we had also had the smallpox vaccination eradication strategy, which was happening. Okay? And most of us can show it. We were vaccinated. So this vaccine prevents smallpox and the Mpox diseases, and especially in high risk individuals. I think later, and from the previous presentations, we've been able to see clearly who is at risk of this disease. The new Mpox vaccine, they are calling it third generation. Right from during the smallpox, the virus keeps, of course, changing. So it has been changing, and now we are in the third generation. It's not a different vaccine, but I don't want to go into scientific details of antigenic drifts and the shifts. But the virus keeps on changing, and it is that change which informs what will be the current formation of the vaccine. So as of today, and as what we have as the Mpox vaccine, they are calling it the third generation vaccine. And this third generation, they are saying, does not produce a lesion. Okay? You can see mine, I can still show it, and maybe for ladies it might not be very comfortable to show because somebody can easily calculate your age. So to us that is also a plus. It is not going to produce this new one, and it has really been improved in terms of safety compared to the other two previous generations. So of course we are always guided by the World Health Organization when these outbreaks occur, and they give recommendations which we also tailor to our context, okay, relating to especially the data and what is happening in our populations. So this vaccination is recommended for persons at high risk of exposure to the Mpox outbreak, okay? So based on what us as a country, and I think this was shown, we've been collecting data. This is what they are calling epidemiology. We've been collecting data which tells us who is getting sick, who is this person, the age, okay, the activities around this person, the occupation, so, and where are these people coming from. When Dr. Michelle was presenting, you could see the corridor. So this data gives us the geographical definition of where we are getting the cases and who are these people who are getting the cases. The other high-risk groups, so we'll base our vaccination on that data. We are also guided to base our vaccination on the risk groups, okay? Sex workers, the gay, the bisexual, other men who have sex with men and have multiple sexual partners, individuals also who have multiple casual sexual partners are also included in this high-risk group. Again, because when these people get sick, they also have to be attended to. They have to be case managed. We also have our team, which are the healthcare workers, okay, working in the laboratories. You've heard the good work the lab is doing. The healthcare workers who do the detection, the healthcare workers who are in the surveillance, the healthcare workers who are participating in the response system are also at risk, okay? And then there is also this other group, these individuals, the cases, these persons who get sick, they are not confined or excluded in a place. They still have their activities. They still have people around them. And these are the people we are calling the contacts, okay? So right from the household to their workplace, to their transportation aspects, we have contacts. So when we look at the activities for a certain period, you can be able now to collect the contacts of these cases. So this vaccination, of course, will be a phased vaccination. We'll look at phase strategies. So immediately, because we are in an outbreak, the first phase is we are responding, okay? Vaccination is one of the key strategies, very significant in outbreak response. And we were told we are in an outbreak situation as a country, okay? So we'll have to stop the outbreak. And one way of stopping the outbreak is targeting the contacts of the cases, okay? And more so, the frontline workers and healthcare workers. This is not the first time it is being used. We are not the only country who are using this vaccination strategy as a response strategy. Other countries like DRC, Rwanda, and Nigeria, they have been able to get their vaccines and they have been able to deploy them. After this, we can get to phase 2 and we'll have an expanded protection where we also look at people who are high risk of getting the severe form of the disease, okay? And this will be informed extensively by our local data, the information which we get from our system, and Dr. Michelle showed you the pillars and the kind of strategies out there. The investigation team, our surveillance team, our epidemiologists, all that information which they are bringing on board will really inform who now gets the expanded protection. And then we have the third phase, which WHO has guided that in future, with recommendations from the vaccine groups, we can now get to other groups. So I think we've talked so much about who is at risk of Mpox infection. So these are individuals who, during the infectious period, have had direct physical contact with case or their body fluids, okay? The infectious period here is being said to be the time when we see the rash, that is when the rash is present, and this can last to 2 to 4 weeks, okay? This can also be those who are in close proximity to people who are already showing signs and symptoms, okay? And we are targeting approximately per case 20 persons. So when you look at that picture, the red case, look around that case, maybe they're not 10, they're around 19, but look at the activities around that case. You can see there's the aspect of close contact, including but not limited to sexual contact. I think that is very, very important to us, okay? Then there's also, this person will travel. This person, of course, is not idle. This person will be out maybe somewhere. Of course, we have households where we only have one member, but ideally we have households which have other members around, okay? So the conduct of at household level, the family members, other people in the same institutions, like us, we've reported here today, we report to our workplaces, we have institutions like schools, okay? We have our other people, important people in the prisons, okay? This person will also be visited. This is according to our culture and the way of life. We have a lot of activities. So even if visitation, it's one of the activities, and we also come in contact. So when you see, when we look for conduct, of course we have a tool which guides on who really qualifies for this to be a conduct, but ideally we look at activities around that individual. Then aside, you can see at the end of the day, these people will report to a healthcare worker, okay? We love the lab personnel, we love our frontline workers, our points of entry workers. All these people are at risk of the infection. So I think this is the most important slide. Like we said, we are responding to an outbreak of Mpox, okay? So it's not a mass campaign. I think we've come to you when we are doing mass campaigns. Our routine systems sometimes inform which disease will need to scale up in terms of vaccination, and we do mass campaign. Mpox vaccination is not a mass campaign, okay? And then Mpox vaccination is not a rollout exercise, okay? We are not introducing a new vaccine, okay? We are responding, okay? So it is an integrated, including the other strategies. Remember, we were given case management, we were given surveillance, we were given infection prevention and control. Is that okay? Including those strategies in place, this is one of the key intervention we are going to include in this response. And it's targeted. We've given you a profile of who we've been guided, and our data has shown that they are at risk, okay? So this is an outbreak control response exercise. Thank you so much.